I thought my life with the new baby, I knew it'd be different, but I don't think I ever really understood how much different it would be.
Very frustrated. Felt like I was doing something wrong. I couldn't do it as good as my wife. There'd be instances where I just have to take a deep breath. I mean, I've been incidents where I've been so frustrated I yelled at the top of my lungs.
I didn't know how to hold her. I didn't know how to soothe her. I didn't know how to make her stop crying.
Yeah, I mean, I knew about purple crying before I had her, but you always think it's not going to be your baby.
As it continued throughout the weeks and months, we soon figured out it wasn't going to be temporary.
Most of us have imagined how our baby will behave. We know that our baby will cry, but we believe we'll be able to soothe him. What actually happens, however, is that soothing works some of the time, but nothing works all of the time.
That's one of the worst things a father can hear is your newborn daughter just crying bloody murder and you can't do anything to help.
When I hold my baby, I should be able to, be the super dad or, be her security blanket. And hasn't always been the case.
I always thought that I could calm her down, even if somebody else could. I could, no matter, I'm the mom. That's my job.
You feel like this is your child and your bond, and that bond should be able to cure anything, but sometimes it doesn't.
Sometimes nothing will work and your baby will continue to cry no matter what you do.
Thoughts had crossed my mind that, I don't know what I'm going to do to this baby if he doesn't stop crying.
I thought I was going to throw her out the window, and so I called my mom, and my mom came. So, yeah, it does get hard, and you don't know what to think. You don't know what to do, but sometimes you just need help.
Soothing is one of the biggest problems for those who care for new babies. So we're going to talk about what's going on when babies cry, how babies can be soothed, and what you can do when soothing doesn't work. Soothing your baby may turn out to be more interesting than you imagined. You might also be surprised by how much you already know. If soothing doesn't work, you may feel tired, frustrated, angry, and very worried. But that does not mean that you or your baby have failed. Sometimes soothing doesn't work, and that's normal and okay.
You just feel like a failure, and you don't know what they want. Sometimes you can't figure it out, and sometimes you won't figure it out, and you just have to accept it.
He would be crying nonstop, and one day I called Jorgen at work and I said, "You need to come home. I can't handle it anymore. I don't know what to do." I put him in his crib and I went in the other room and I screamed myself, and I don't know what else to do.
What's going on when babies cry? As you have learned from the Period of Purple Crying DVD and booklet, the amount of crying that all healthy babies do begins to increase at about 2 weeks of age, is the most during the second or third month, and may continue until your baby is about 4 to 5 months of age.
During this period, some babies are said to have colic. This can be confusing and concerning. It sounds like an illness and suggests that only some babies cry a lot, while others do not. But the period of purple crying is a period of increased crying that all babies go through, and that is completely normal.
This early increase in crying includes fussing, crying, and some crying that cannot be soothed even when your baby has been fed, burped, and changed.
Crying that can't be soothed can happen a lot in the first 5 months, but it's uncommon after 5 months. When it happens, you may feel frustrated, worried, and angry. You may feel like you have failed at caring for your baby. So let's talk about what you and others can do to make this early crying as good an experience as it can be.
The best thing about soothing your baby is that there are a number of simple, available ways to soothe that anyone can use. They are things you can do naturally that don't require special skills or using any store-bought items. Changing a baby's position can be soothing. For example, This happens when moving your baby from a cradle hold to upright on your shoulder, or picking up your baby from a crib. Movement can be soothing. For example, this happens when carrying your baby in a baby carrier or sling, taking your baby for a walk or a car ride, or rocking your baby gently back and forth. White noise is a kind of background noise that can be soothing. White noise comes from the sounds of running water or waves, the whirring of a fan, a dishwasher, bubbles in a fish tank, or the sound of a vacuum cleaner.
I would take Chase, our first son, into the bathroom and turn the shower on. And I don't know if it was the shower, a little bit of the steam, or what, but that would soothe him and he'd be able to fall asleep.
Rhythms and repetition can be soothing. This happens when you sing a lullaby to your baby. Your baby hears your heartbeat when you're holding her to your chest. Going for a car ride by the sound of tires on pavement. Or going for a walk by the sound of footsteps. Smells and a change in smells can be soothing. This happens when a different person takes care of your baby, which means a change in smells for your baby. Going outside to take a walk. Or when giving your baby a bath. Sucking can be soothing. Perhaps the best example is when an infant is breastfeeding. But infants are also soothed by sucking that is not from being hungry. This happens when allowing your baby to suck his own finger, sucking on your cleaned finger, or sucking a pacifier. Pacifiers can be used after breastfeeding is going well. Closeness can be soothing. The best example of this is just holding your baby. He feels warmth from your body, touch from your skin, and a smell that your baby is used to. Now here's something important. Sights, sounds, and smells of a person are more soothing than any toys, mobiles, or other things you can buy. Putting many of these ways of soothing together can be even better. Each way of soothing by itself helps, but they're more effective when done together. Breastfeeding involves more of your baby's senses at one time than any other way to soothe. Breastfeeding is probably the best soothing behavior we know. Fathers or others caring for your baby can give almost the same soothing by being skin to skin with their baby. If the baby has something to suck on, it's even better.
We've suggested a lot of things to try, and you might be wondering, is there a best way to soothe my baby? Well, there is no best way, but there are 5 that we like the most. These include holding your baby in your arms or with a baby carrier or sling, breastfeeding, putting your baby skin to skin, letting your baby suck on his own finger, your clean finger, or a pacifier, or going for a walk. However, if your baby is crying hard, it may be difficult to do these things. If you're feeling angry or frustrated, you may need to put your baby down and try again later.
We have talked about many experiences happening at the same time, all of which can be soothing. But you should be aware of something that's the opposite of soothing, called overstimulation.
As an adult, you know when things are too confusing, too busy, or too much to deal with in a day. But your baby depends on you to make sure this doesn't happen to him. The key here is to put your baby first by listening to him, watching his behavior, and what's working for him. For example, if you have lots of people over visiting or are trying to distract your baby with noise and bright lights, and your baby cries more, this may be overstimulating your baby. Everything you do to soothe your baby must be done safely. For example, safety instructions must be followed on how to place your baby properly in a car seat to prevent risk of injury. Also, it's important to never fall asleep with your baby on a couch or in a bed. This may risk the danger of blocking your infant's breathing. However you choose to soothe your baby, use common sense to keep your baby safe.
There are things you can buy that use some of the soothing ideas we have talked about, such as machines that produce the sounds of heartbeats, white noise, rain, or other sounds of nature. There are crib vibrators and rockers, baby swings, and lullaby CDs. If okay for your baby's age, they can work too. However, none of them do anything differently or work better than you can do yourself, or doing what comes naturally. There are two more general things to suggest when soothing your baby. 1. Soothing works better if used as a typical part of daily baby care rather than only after crying begins.
Rather than just carrying your baby when he's crying, carry your baby even when he isn't crying. Your baby will be calmer if you use the ways of soothing we've talked about as part of your daily baby care. Despite it being a common belief, there is no evidence that this will spoil your baby.
2. Some ways to soothe your baby work some of the time, but nothing works all of the time.
It would be great if you just had the right way to soothe and crying would stop. But babies aren't like that. They don't have an on-off switch like machines do. It's completely normal that soothing works some of the time, but nothing works all of the time.
What happens if you think something you do to soothe your baby will work, and it doesn't?
You may think you have failed somehow, or that you have a bad baby. If you think it was the right way to soothe your baby, you may feel even worse. But unsuccessful soothing is okay, expected, and normal. When soothing doesn't work, you need to find ways to help yourself, or ways to cope. You can't help soothe your baby unless you are calm yourself.
We have all been told about ways to calm down. Exercise, listen to music, take deep breaths, and so on. If these work for you, do them. But when you're stressed, these may not be easy to do.
For myself, I'll just get on the computer because work kind of soothes me, and so just thinking that I'm being productive in some way. If I can't be with the child, then at least I can answer some emails or something. And we like to go outside and sit on the bench.
I go out and do yard work. As much as I hate yard work, it's my time alone.
Something you can do is simply to try and understand what it is you're feeling and allow yourself to feel that. One way to do this is to become focused on what you're doing. For example, if you're fixing dinner, tell yourself, I'm fixing dinner, and things will get better. You might feel funny doing this, but it will bring your thoughts back to what you're doing at the moment. This can help you control your upsetting feelings. The main point is to do whatever you need to do to help yourself be calm.
Doing things that I like to do while she was asleep taking naps was a great help.
Some of the things you do to soothe your baby may also be calming for you. Going for a walk gets you out of your home, gets you moving, and gets you into fresh air. Or closeness from holding your baby gives you a chance to enjoy the comfort this brings and helps you be calm.
It's okay to take a break, and to take a break responsibly. Maybe in your family or culture, you're not supposed to leave your baby even for a moment. Maybe you believe you're doing something wrong or being selfish. Maybe others will say this to you.
Some of my family has a hard time understanding that she just cries because she just cries. She's not sick. She doesn't have an upset stomach. So they think that there's something to do. You should be able to fix it.
For my first experience, when I really thought I was going to hurt my child, I never would have forgiven myself if I would have done something, but I can forgive myself for leaving her in her room.
But if you are feeling frustrated, the best thing you can do is to get away from the crying for a while and calm down. This does not mean that you are a bad mother or father. It only means that you are normal.
When you do take a break responsibly. Lay your baby on their back. Lay your baby in a safe place like a crib. Take some time to calm down, but check on your baby often, about every 10 to 15 minutes.
It's okay to ask for help. Ask someone you trust. a spouse, a partner, a friend, a grandparent. Ask somebody who can be patient with a crying baby. Tell them about the period of purple crying and that it's normal. And of course, you can always ask your healthcare provider for advice.
This can be a hard time for a new parent and their family. Try to remember 4 important things about soothing as you and your baby go through this period. Soothing your baby works some of the time, but nothing works all of the time. Soothing works better if used as a typical part of daily baby care rather than only after crying begins. If soothing doesn't work, it does not mean you have failed or that you have a bad baby. Soothing that doesn't work is okay, expected, and normal. The crying is only for a period. This too will come to an end when your baby is about 4 or 5 months of age.
As we talked about, all of the ways of soothing your baby are things you can do yourself, and they're best done by you when you're taking care of your baby. Keep trying different ways of soothing your baby. They can be more interesting and imaginative than you think. And remember, it's okay to be frustrated. It's what you do when you're frustrated that's important.
I think the best experience I had is the first time she really smiled. Not the little half smile or whatever, but the first real smile that you knew that was coming because you were making her smile.
It's easy to get caught up in an hour of screaming and think it's going to go on forever and ever, but it will end.
As much as I say she cries, but when I can make her laugh, it makes me feel so good. I can see that smile on her face.
Holding my sons close to me, regardless of whether they're crying or not, it's special. So I think, especially when it works out, you can take weeks of crying and crying, but when they fall asleep and you're holding them close in your hands, it makes it all worth it. So.